This is Dolly's story. Before we start, you need to know some background information. When our story starts, Dolly is a 71-year-old woman who has 3 children and many grandchildren. Dolly and her husband have spent the last 15 years taking care of 3 consumers from Broome Developmental, providing them with a safe place to live. Our story starts in June 2012. Dolly is admitted into the hospital for out-of-control symptoms related to her end-stage COPD. While in the hospital, Dolly's symptoms progress and she is moved to ICU. Dolly does not feel she has good quality of life. Her symptoms are causing her a lot of distress. She is ready to give up. She wants to sign herself out of the hospital AMA. The hospital recognized that this would not be safe for Dolly, and if she no longer wished to pursue aggressive treatment, she would be safely discharged home with hospice care. Our admissions nurse came to the hospital and told Dolly if she could stay in the hospital one more day, hospice could bring her home tomorrow. That night, Karen, the admissions nurse, ordered medical equipment to be delivered to Dolly's home so that her transition could be made as easily as possible. This is the point in the story where most people think there is no hope. Dolly is giving up on life. This is the point in our patient's life where we ask them to redefine hope. The hope to be pain-free, the hope to never go back to the hospital, the hope that your family will honor your wishes at the end of life. All the staff at hospice believe that the end of the journey is still part of the journey and there is room for growth. In Dolly's case, her hope was that her family would help take care of her and she would not have to go back to the hospital. She wanted to be managed at home. She also hoped that she would have time to make sure her family would be okay. When Dolly gets home, she doesn't get into her hospital bed. She gets into her bed, and she starts directing her husband, Lou. She helps Lou schedule appointments for the consumers, starts to get her finances and paperwork in order, and begins to help Lou figure out how he will manage the family when she is gone. A couple of days after she is home, a cardinal pops up outside her window. She names him Wilbur. He starts coming back every day, and Dolly tells people that she believes Wilbur is her guardian angel. Dolly and Lou take advantage of every service offered at hospice to help them. Volunteers sat respite 1 to 2 times a week so Lou could take the consumers to appointments and Dolly wouldn't be alone. The medical equipment, commode, walker, and bed help Dolly maintain a level of independence. The chaplain provides weekly visits to help Dolly stay connected to her faith. The LPN comes a couple of times a week to help Dolly with showering and grooming. The RN comes at least once a week to help monitor and control Dolly's symptoms. There is always an RN available to Dolly and Lou, even in the middle of the night, to answer questions and make visits. This brings us to the fall. Dolly has already lived 3 months past her hospital stay. Dolly is starting to feel better. Her symptoms are being well managed, so much so that she is able to travel to Red Lobster to have an anniversary dinner with her husband. As she starts to feel better, Dolly is ready to establish some goals. The first, she has 3 great-grandbabies and her first great-great-grandbaby due in the early winter. She wants to see them all be born. She starts knitting booties in anticipation of the babies' arrivals. Finally, she wants to record a legacy for her family. She starts working on recording messages for them using equipment provided by the Hospice Legacy program. Wilbur is still there. By now, the connection between Wilbur and Dolly is so great that people are bringing cardinal presents for Dolly when they come to visit her. Before Dolly's hospital visit, she hosted weekly Friday night dinners for her family. These were really important to her, and she continued to host them when she got home. In the fall, one of her granddaughters puts a trailer in behind Dolly's house and began to work toward her respite license. The family had decided that they were going to do all they could to allow the Broome Developmental consumers to stay with them as a way to honor Dolly's caring spirit. Moving the trailer in also allows more family members to help care for Dolly. As the fall turns colder, Dolly starts to feel worse. She begins to have frequent infections that she chooses to treat with antibiotics. She is still in total control of decisions regarding her health. She is spending more time in bed. The family uses hospice volunteers much less. Organizing family to be with Dolly, the LPN is increased as Dolly is now more dependent on others for her personal care. The last grandchild is born right before Christmas. Dolly hosts the family Christmas celebration at her house. She gives the family members CDs of the legacy she recorded for them, personal messages about how much she loves them, their fond memories together, and her hopes for their future. I believe Dolly recognized that at the end of life she had an opportunity to die her way, and she seized it. Her peace came knowing that she was able to spend precious months with her family at her home and had the chance to help them get ready for when she wouldn't be there. It wasn't always easy for them. They put in a lot of hard work and tears. Dolly passed away January 18, 2013, at her home, surrounded by her family. Since Dolly's death, the Hospice Bereavement Program has followed her family, offering support throughout. This has included mailings, newsletters, offering tips about bereavement, invitations to support groups, offerings of individual or family counseling, quarterly telephone calls to Lou to touch base and offer him support.